Aloha, my name is Djou. I'm a member of the Honolulu City Council, and I just want to thank each and every one of you for joining us here this evening on this Town Hall Forum on healthcare. I appreciate all of your interest on this major topic affecting our community as well as our nation. This is Dr. Rasmussen. Again, she's an orthopedic surgeon and a member of the Hawaii Medical Association. She's here to give her perspective as a medical doctor on healthcare and healthcare reform. Dr. Rasmussen.
If we look at the major issues with the proposed care, we have to look at how are we going to sustain this and afford it. And the problem is liability reform is not addressed. And there are ways to improve the current situation so that actually more patients that are injured receive money in a more timely fashion and save tons of money that can be used to cover the uninsured, to cover those that need medical care and cannot get it. Costs are not controlled without that. The financial burden is huge. And you also have to look at, will there be enough physicians in any kind of healthcare reform that you're dealing with. So for the victims of an out-of-control tort system, this affects all of us. In Kailua, we lost 2 OBGYNs just last month. Dr. Heather Wyatt is younger than me and stopped practicing OBGYN because of the medical, or because of the liability. And Dr. Sarah Scute left. So the few OBGYNs that are left are delivering more and more babies, less time with their kids. You can do that for a while, but after a while you burn out. We used to have 7 orthopedic surgeons on the windward side. There's 3.5 of us. Monday, I did 5 new hips and knees, saw 22 patients in the office, and worked until about 8 o'clock at night, and today was no better. So, you know, you can keep up that schedule, but I have 3 kids, 2 in high school, and it's hard to keep up that. So physicians burn out, and they can only do so much where they're carrying the load of the number of doctors. Defensive medicine is the cost, and is when you order a test, and then mainly you're ordering it to cover your butt so you're not sued. 92% of physicians order tests that are unnecessary in order to avoid being sued. And this is expensive, and it's a huge cost driver. If you look at countries that have universal care, they do not have the liability issues that bring in the tort problem, and that's the only way they're successful. Medical liability issues have increased, and it costs $124 billion just ordering unnecessary tests. And the other problem is you keep ordering that necessary test, and that becomes the standard of care. And everyone expects an MRI when they're back hurts. Everyone expects, you know, a PET scan for this, and it becomes a huge burden. So the cost to the American people, this is an important slide if you don't take out anything else. The cost to the American people is $1,700 to $2,000 per American family in the United States. That's something other countries that have coverage for everyone do not have. And imagine all the uninsured, we can insure all the uninsured people in the United States with the cost of defensive medicine. So liability reform will reduce the defensive medicine costs. Overall, it would lead to a 5 to 9% reduction in overall medical expenditures. The current tort system doesn't work. Patients are not compensated in a timely manner. Trials take 5 to 7 years. Lawyers end up with the largest share of the money, 54%. They take 33% and then add on all their fees, and it turns out to about 54%. So the injured person is not the one that gets the money, the lawyers get the money. We need to do something, and part of medical reform is not taking away anyone's ability to sue at all. What it does is it restrains the lawyers so that they get a certain percentage of the award, and they don't end up with the whole award. Lawsuits against physicians do not decrease errors. Most cases take 5 years, as I mentioned, go to trial. An emotional toll on physicians and on the injured person is huge. And then the physicians limit. They don't take the high-risk OBGYN cases. Those cases that have a real hard time finding a good physician. Reimbursement to physicians in hospitals decline despite increasing malpractice rates. The malpractice rates have increased 920% from 1976 to 2002, and they continue to increase. If that cost is not reined in, how can you we going to pay physicians a set rate and not adjust for the cost of liability? Access to care progressively diminished, and what the problem is a lot of the emergency room physicians are the ones that are more liable to lawsuits. So we have the problem with having adequate access of patients to physicians in the emergency room. The costs are increased, so that's a big cost driver of what you pay in your insurance premiums. And many students that are medical students choose not to go into OBGYN, orthopedic surgery, neurosurgery because of the liability risk. This has a negative change in the doctor-patient relationship. Physicians that have been sued see their patients as potentially suing them. And every patient is seen as that rather than as a patient, which is very sad. In Mississippi, the passage of medical tort reform decreased the number of malpractices from 1,475 to 192. So huge decrease in the number of lawsuits. And in Texas, in one county, it went from 745 to 49. In Mississippi, in Texas, both states had a huge economic boom, huge influx of physicians, improved access to care as a result of passing medical liability reform. So it sounds, the government-sponsored health plan sounds good in theory, but look at what happened to KP Care here in Hawaii. We opened up a plan, and 80% of the kids that joined that KP Care already had private insurance. So it basically bankrupted the system, and it's already folded. So you have to, there's got to be a way in this plan that we avoid that happening.